So then are the techniques that you use or the strategies you use matched to those particular stages?
Exactly right. We call that stage matching. Both treatment strategies and relationship stances differ depending where the patient is.
Can you give an example?
Sure. Well, for example, the patient that I interviewed, LC, he presents in the maintenance stage with regard to his cocaine abuse. He has been abstinent for over a year, and he's working on to prevent relapse. So my relationship style with him is much more as a coach, an experienced consultant saying, let's look at your relapse prevention plan. How are we going to avoid slips? On the other hand, he is only in preparation with regard to his alcohol abuse. He knows it's a problem. He's tried to cut down a little, but and you can see it, he's a little anxious. At that point, I'm much more of a, let's call it a Socratic teacher, where awareness, small baby steps, helping him develop a plan. And even for other, like most people, he presents with a multitude of problems related to his addiction. He's also in contemplation with regard to what he wants to do with his life, his job, his relationships. So there we are much more in the way of a nurturing parent, helping him understand his goals. So the treatment strategies and my relationship stance just move along with the patient.
What we're going to do now is we're going to watch you work with LC. Can you help our viewers know what they should be looking for, how this model's working?
Well, within the context of the single session, I would hope they would see three things.
Okay.
First, how we assess the stages of change by asking him where he is in this process. And then how my relationship stance and treatment strategies differ depending upon which stage of change he is. This is somewhat subtle. In fact, one of my supervisees once said, you know, I always imagine you held up a sign to the client and said, you are now entering the contemplation stage. No, good therapy is a little more fluid and seamless than that. But if you, for example, compare our discussion and how I am with him during maintenance to his very hesitant, almost halting ways of improving his alcohol use, you'll notice that we're really relationally and technically doing different things. The second thing, and it comes up fairly briefly at the beginning, is how I tried to tailor my relationship stance to LC. In the same way we try to adapt treatment, the treatment of choice, we're also trying to customize the relationship of choice. And third, though it's fairly brief in this, we do try to accelerate the whole change process by mobilizing as much as this man's strengths, past successes, through self-help. So I gave him a list of some self-help groups, books, and movies that other of my patients and colleagues have recommended. Because once again, therapy is a small part of his greater change enterprise.
So we look for assessment, the tailoring of the strategies and the relationship style, and then the use of self-help and other methods to enhance the intervention?
Yes.
Great.
It's a great summary.
Let's watch.